All right. Welcome to summer school. So you have 6 essential assignments. For a couple of assignments, I went ahead and included a PowerPoint like this one, Introduction to the Heart. I'm going to go over those 6 essential assignments with you, and hopefully this will help you complete it. So the first assignment is this one, Intro to the Heart questions. Okay, this is based on this PowerPoint, Introduction to the Heart. So you have a print copy of this one. So you can go through this, answer your questions. It's all based on it. When you get down to number 9, there's not an answer in this spot right here. All right. Number 9 just talks about the blood flow through the heart. Here's an image of the blood flow through the heart. So you can look at that, and hopefully that will help you answer these questions. Down here, it says there are 8 questions at the end of the PowerPoint. Try to answer all 8 correctly using the diagram above. So you'll put your answers in here. Now, the questions it's talking about is at the intro to the heart. So if I scroll down all the way to the bottom, and there's some more images here that talks about the cardiac circulation. You scroll down here, it says, I am the valve that deoxygenated blood flows through, and I'm between the right atrium and the right ventricle. What am I? Well, let's look at our image. This is the right atrium, and this is the right ventricle. So what is this valve right here? It's the tricuspid valve. Tricuspid valve right here. So that's the answer that you would put on number 1 there. And you continue to go through each question. The structure dumps deoxygenated blood into a certain atrium. What atrium and what are the structures? So where does deoxygenated blood go to? Is it the right atrium or the left atrium? And what is the structure that dumps it into? So you're going to look here again, find the right atrium, find the name of these structures that have the arrows pointing into the right atrium. What's that structure? All right, that's assignment number 1. Assignment number 2 is the heart disease activity. Now, several people had questions on this one, but it's really not that complicated. Right here, it talks about the background of heart disease. Here is a chart. And in each chart, it lists, or not each chart, but each section here, these are risk factors: gender, age, body weight, cholesterol, systolic blood pressure, smoking, exercise, and family history. Some of these you can control. Which ones can you control? That's one of the questions here. You actually can do a little bit to help control your cholesterol level and your systolic blood pressure, but also your body weight, smoking, exercise. So to the right, it gives you a point value. So if a person is a female and they're under 40, they're going to get 1 point. If they're a female, age 40 to 50, right here, 2 points. Over 50, 3 points. If they're male, regardless of age, they get 5 points. Down here, if they're 10 to 20 years old, you're going to give them 1 point. 21 to 30, 2 points, etc. All right, all the way up to 8 points here. Look at this chart. Where is the highest point value? I see 10 right here on cigarettes. That means that cigarettes have one of the highest risk factors to get heart disease. Okay, so you're going to look at these numbers here. The ones that have the highest number are the ones that can cause or have the greatest risk factor to cause heart disease. Down, you have some questions to ask about the chart. I want to see if you understand what the chart is saying. And then you're going to analyze some patients. So you're given 6 patients down here. Benjamin, this is supposed to say Leslie. Let's change that to Leslie. Leslie. But on your print form, it's going to say whatever that word was. And under each patient, it tells you all about them: their age, blood cholesterol, if they smoke 30 cigarettes a day, if they don't smoke, how much exercise they get, what their weight is, systolic blood pressure. You're going to take all that information, look at your top chart here. So, for example, Benjamin, he's age 56. cholesterol 261. So he's a male. So we're going to go to Benjamin. He's a male, so he gets 5 points. How do I know that? Well, I look at this chart up here. He's a male, and it says 5 points. He's 56 years old, so let's look at age. 51 to 60, he's going to get 6 points. Cholesterol level was, what, 261, something like that? So he'll get 4 points. Smoking, 30 cigarettes a day, so 6 or 10, whichever one you want to put there is fine. Exercise, he's a couch potato, none, so we're going to put 8. So we're going to fill all of that out in these squares for each patient. Then you're going to list your total here. Once you get your total, which patient has the lowest risk factor, that's going to be the patient with the lowest number. What factors help them keep their risk disease low? Risk of heart disease low. Who has the highest one? That's going to be the highest number. Don't forget, there are questions at the bottom. Down here, you're going to write all of your patients and what their total score was. You're going to give each one specific advice, the ones that had a high risk of developing heart disease. If you have a family history of heart disease, does this mean you'll have it? Explain your answer. I don't want one word there, just explain it. And then which risk factors are ones you can control right here. Okay? So that's assignment number 2. Assignment number 3 is called the digestive system foldable. On the directions it says to color it, but you don't have to color it. All I want you to do is, here is your foldable. You're going to write down the function of each organ system. So the oral cavity, what's the function? The tongue, the teeth. Fill in these squares. Again, you don't have to color it, okay? You can use this PowerPoint right here, the digestive system, for your answers, or you can look them up on the web somewhere. And here are the directions. So with these, you'll cut them out, cut on the dotted lines, and then you'll tape them together so that it makes it foldable. So just follow those directions there. Basically, you'll cut this one out, tape it to this one, the second one, and tape the bottom one here on the dotted line to the second one. Okay, the third assignment is the Big Mac attack. Again, you're probably going to want to use this PowerPoint here, the digestive system PowerPoint, to help you answer the first questions on the Big Mac attack. And just follow the instructions. It does say, using the diagram, circle the name of the organs and make up the alimentary canal. So the alimentary canal is this long tube that starts at the mouth and goes all the way to the stomach, small intestine, large intestine, and to the rectum and to the anus. So you're going to list all of those things, and you're going to circle the names of the organs that make up the alimentary canal. And then you're going to list the organs of the alimentary canal in order. What is an accessory organ? Go back to your PowerPoint, look that up, and list your accessory organs. And then here, you're going to practice reading nutritional facts about the Big Mac. You're going to have to learn your knowledge or use your knowledge down at the bottom where it asks you what components of the Big Mac do you think are fats? Look at this. What would that be? Would it be the cheese, the beef, the special sauce, the tomatoes? What is it? What percent of daily values of fats is obtained by eating the Big Mac? Go up here and you're going to use your nutritional facts chart to answer those questions. Let's change that word to the correct spelling. Okay, down at the bottom, this right here talks about chemical digestion and mechanical digestion. Mechanical digestion is the chewing, the moistening, the churning in your stomach. Chemical digestion are different things in your body that's released to dissolve and to digest certain substances, like salivary amylase. It starts in your mouth. It's in your saliva. It's used to digest complex carbohydrates. And then what it produces is disaccharides and trisaccharides. And that's in simplest forms, that's what your body then will use for energy. Chemical digestion, pepsin is also released from the pancreas, and it targets proteins and it produces polypeptides. You're going to use that chart to answer these questions down below. Okay, the last two assignments are pretty self-explanatory. Female reproductive system, you're going to read through the article and answer the questions, right? Now, the one thing you might have to look up is this structure right here. This is a picture of the female reproductive tract. What label the structures in the diagram? So what's number 1? What's number 2, 3? So you might need to do a little research and look that up and see if you can come up with the right answers. And then we have the male reproductive system. Same thing, exactly the same thing. All right, good luck to you guys. Missed you this year, and a good summer, and I hope that you are doing well.